Hello, welcome to this journal club of the European Journal of Cardiovascular Nursing. My name is Philip Mons, Professor of Nursing at the University of Leuven in Belgium, University of Gothenburg, Sweden, and Cape Town in South Africa. And I'm an Associate Editor of the European Journal of Cardiovascular Nursing. In the April 2020 issue of the journal, a paper was published with the title "Perceived Health Competence Predicts Anxiety and Depressive Symptoms After a 3-Year Follow-up Among Adolescents and Adults with Congenital Heart Disease." And today in this journal club, we are talking with Dr. Jamie Jackson. Dr. Jackson was the senior author of this paper. She is affiliated to the Center for Biobehavioral Health at Nationwide Children's Hospital in Columbus, Ohio, in the United States. Welcome to this journal club, Dr. Jackson.
Thank you so much, Dr. Boones. I appreciate it. And thank you to EJCN for having me.
Good. The title already sounds very exciting. Can you briefly explain what the study was all about?
Sure. So our study aimed to examine how perceived health competence, which is how confident one feels about taking care of their health generally, may predict emotional well-being 3 years down the road among adolescent and young adult congenital heart disease survivors.
Okay, and what was actually the rationale to do this study? What brought you to take this study up?
Yeah, that's a great question. Well, originally we had not thought of this as a longitudinal study. Originally, it was just a cross-sectional design. And I had collected some baseline data to explore the associations between some of the patient-reported outcomes of interest, which included perceived health competence. But then I was fortunate enough to have the opportunity to actually query the same participants 3 years later, which brought about a whole new set of questions that we wanted to answer, of course. And this included exploring whether or not perceived health competence predicted emotional well-being 3 years later. And one of my areas of interest is how transition age congenital heart disease survivors view and manage their disease and general health. So it was really exciting for us to successfully recruit 81% of that original sample to participate in a 3-year follow-up so that we could ask some of these new, more nuanced questions.
Well, you investigated perceived health competence, as you indicated. That sounds a very exciting construct. Can you tell us more about this? What is perceived health competence precisely?
Yeah, absolutely. So perceived health competence is a type of health-related self-efficacy. And we use the perceived health competence scale, which measures how individuals perceive their ability to manage their health, generally speaking. So for example, one of the items is I handle myself well with respect to my health. So pretty general. And this measure has been used in other chronic health populations and has also been associated with emotional distress in those other populations. And so given that and how important emotional distress as a topic is within congenital heart disease survivors, we at and examine within our transition age congenital heart disease survivors.
In follow-up with this question, it sounds that perceived health competence is related or a bit linked to other familiar concepts that we are using as nurses and allied professions. With what other concepts do you think that perceived health competence is related to?
Yeah, absolutely. Well, so I think the big one that comes to mind is self-efficacy, and I may have already used that word, I think, when I was responding to you, and it's probably a term that more individuals are probably familiar with. So self-efficacy is a broad umbrella concept that refers to how capable someone feels of engaging in some particular type of health behavior. Some of my other work is focused on physical activity engagement, as an example. And so in my other work, we we specifically look at self-efficacy for engaging in physical activity. And other health behavior change models, including like the social cognitive theory or a theory of planned behavior, they also either include self-efficacy as an important component, or at least some element that's akin to self-efficacy. So I think as a broad concept, self-efficacy is, a popular and important factor to consider, and perceived health competence is very akin to that. For the particular study, we weren't really interested in one type of health behavior, so it really seemed fitting for us to use something that is more generally focused on how one thinks about and manages their health at that more kind of global level rather than a specific behavior.
Thank you for this explanation. This is really interesting, and probably more researchers will use this concept in their study. Going back to your study, can you tell us a bit more about the design that you have used to investigate your research questions?
Yeah, so again, originally we hadn't intended on this being a longitudinal design, but when you think about the types of questions that we wanted to answer in this particular study, where, how will one variable impact or potentially predict another variable at a future time point, you really do need that longitudinal design. And so I feel very fortunate that I was in the position and I had the funds, most importantly, in order to re-recruit those individuals and actually look at this in a longitudinal format with 3 years, down the road, 3 years later. Another element, and I can't really necessarily say that this was specific to the study design, but is something that we had decided to do early on, which I also hope or think made a difference. We really tried to keep participants newsletters that we would send out about every 6 months to our participants. And the newsletters would include, after something had been peer reviewed and accepted in a journal, we would give them a little bit of snippet of what some of the findings were. And a lot of people found, I think they really feel more engaged in part of the research when they know what their data is culminating in, as well as even some, little tidbits like heart healthy recipes and things like that, just to try to keep folks aware that we're here, we appreciate them. And I hope that also made a difference in us being able to have such great success with re-recruiting 81% of the sample.
Clearly an important strategy to keep people motivated to continue participation. That's for sure. Of course, the viewer of this journal club is very interested to learn about the findings of your study. Can you give a view on what did you learn from this study?
Yeah, so just a quick synopsis. The main finding from the study was that, congenital heart disease survivors who feel more competent in managing their health generally report fewer anxiety and depressive symptoms 3 years later. Now, there are certainly many factors that come into play when thinking about one's emotional well-being. But I think what our studies suggest is that one potentially important component of that is how capable someone who has congenital heart disease feels about managing their disease. And that is playing an important role in their future emotional well-being. And obviously, we would suggest, additional research in order to, really tease out what some of those other factors may be contributing. But I think this gives us a good sense that this is yet another important factor to consider for emotional well-being in this population.
And thinking about translating your findings to clinical practice, what can cardiovascular nurses, what can allied professions do with the results from your study?
Yeah, excellent question. And, I think that well-being that are modifiable. And I think that was one thing that really excited me about perceived health competence, is that this really, being akin to self-efficacy, is certainly something that I think we can intervene upon. And nurses and other allied health professionals would be the people who could potentially do that. And whether that means either screening for something like self-efficacy or perceived health competence within the clinic setting, or even just potentially initiating a conversation feel managing their health, how's that been going for them, what barriers they're encountering. Just even that type of simple conversation might help patients feel more capable. And again, we would certainly need more research to know whether or not this truly is something that can be modifiable, and what types of intervention strategies would work the best. But I think at least this preliminary data suggests that having those types of conversations with patients could potentially go a long way to helping them feel more capable.
Thank you. Thank you so much for this explanation. It's absolutely once again, a very interesting construct in a very interesting population, with clearly a great opportunity for implications into clinical practice. We come to the end of this journal club. I would like to thank the viewers of this journal club, and definitely would recommend to read the paper of Dr. Jackson and her team that was published in the April journal of 2020. Thank you, and see you in one of the next journal clubs.
Thank you, Dr. Moons, and thank you, EJCN, again. Thank you.